Thank you so much to everybody who has joined us today for our second webinar in the inclusion series. I'm sure a few people may join as we go, but we'll get started for those of you who have joined us on time. So thank you so much. We had another one in October, and if you missed that one, then the recording is on YouTube. But today's session is going to be about discussing policy and how to implement it, strategy in terms of IEP targets and organisation of CPD, and then we're also going to be looking at how to create a collaborative space and the benefits of that. So we are going to be joined by two experienced inclusion leads from the Aldar network, and we'll do introductions shortly. So thank you both in advance for your time and for sharing your expertise. You will see that it is only myself and the speakers who have microphone and camera access, just for the ease and flow of the webinar. However, the chat facility is open, so should you wish to ask any questions or make any comments, then feel free to write in those. Also, it would be great if you wanted to use your reactions to be able to participate as well. So we'll sporadically review some of the comments and Q&A section, and I'll direct those to the speakers at opportune moments during the webinar. So today we'll start with some introductions, and we'll also introduce the two people joining me. We will be here for approximately an hour, and then we will hear firstly from Jason Todd, who is the Head of Inclusion at Yasmina British Academy, and Jeanette Moore, who is the Assistant Principal for Inclusion at Cranleigh Abu Dhabi. We're going to be looking at how Jason has gone about ensuring that his staff receive professional development that they both need and want, and how to create a collaborative environment between staff, the inclusion department, how to share best practice in terms of inclusion and pedagogy for ALN students, some of the best practices that he's seen and been part of in terms of MER processes at Yasmina, and how he selects and evaluates his interventions for his students across the different tiers, and how he looks at making sure that both he and his staff contribute to his students making outstanding progress on their IEPs or DLPs. We're then going to be having a chance to speak to Jeanette to hear about how Cranleigh have adapted and implemented their policy changes in the school, and how they ensure equitable access and effective quality in their in-school services. And then finally, how she works with parents and the wider community to make sure that the environment is truly inclusive. We will then have time for Q&A, as I said, and hopefully at the end, you'll also be able to give us some feedback on today's webinar, what went well, what we could improve, as well as perhaps some ideas of things that we could look at including in terms of topics in future webinars too. So without further ado, we will speak to Jason, and I'll hand over to him, who, as I said, is joining us from Yasmina British School today. And you'll have seen that he is going to speak to what he's going to be speaking to us about, and he has gathered some evidence for us too. So, Jason, are you there? Please introduce yourself and some of the things that you've been doing to support the development of your staff.
Hi, good afternoon, everybody. Welcome. I don't proclaim to be the font of knowledge, and I would very much like to work with you all to get your experiences as well. But this is what we do at Yasmina British Academy, and I hope you can take some of these ideas on to instill in your own practices. And absolutely, I would love you to share your practice with us as well. I think inclusion is so important across the world. Here in Abu Dhabi, it's a major focus at the moment, with ADEC especially, and those in Dubai as well. And I think it's important that we're all working together to bring that diversity, that inclusion, and make it a real focus. So I just wanted to start by saying I love this quote. I think it resonates in what we do in the classroom, but also as an inclusion department, so that in diversity is being included and being invited to the party, whereas inclusion is being asked to dance. I think when you look at it, it's about inclusive schools, inclusive ethos, having inclusive values, but actually it's about getting the students into the classroom and getting them engaged with learning activities. I think inclusion is about having those students part of every working opportunity in the classroom and learning alongside their peers and learning from each other. And I think that's how you grow that whole school inclusive ethos as well. Just to move on from here, we'll start by looking at the training of individual assistants. So those who are based in Abu Dhabi will know that ADEC policy has been introduced and will be fully up and running from September of this year, next academic year. And it's important just to highlight at this point that our individual assistants are some of the key players, some of the key people that work with our students on the ground, day in, day out. And, you know, they really do put the hard effort and work in, and those hard yards can pay off. Absolutely, they can. And I'm sure you'll see that on a day-to-day. It was Inclusion UK that said that 80% of schools that have invested in shadow teaching programs or training programs, they reported seeing a reduction in teacher burnout, but also an increase in outcomes for the students. So it just shows that having that additional person in school is really going to benefit the student, the other students in the classroom, and also the teachers that are there as well. One note I just want to highlight here is when the policy, although the policy is live now, we will be getting inspected against the policy, and it says that individual assistants are not to be used for academic purposes. So they're not there to lead on the learning. That quality first teaching has to come from the classroom teacher. The individual assistant can be there to be used for logistics, safety, any medical needs, and SEMH, the social, emotional, mental health needs as well. Please remember that I know it probably has happened, and I hold my hands up in Yasmin, it's happened previously in my previous roles. A lot of academic rigor has been put through the IAs, and that is something we need to pull away from to be in line with ADEC policy. So the importance of having an IA in the setting. Ultimately, when we do the onboarding system and we go through the safeguarding training with them, we go through our enrolment and school expectations, we do health and safety training right at the very start of when they've come on board. From there, we look at what their skill sets are, making sure that they meet the students' needs effectively, and then how we can train them and upskill them further to ensure that they are going to meet the needs of the student they're working with on a day-to-day basis. What we do at Yasmina is we try and find 4 dates across the academic year. So that'll be 1 date per term where we identify a key date and we say, okay, we're going to put 2 hours or maybe 1 hour of CPD in for each IA that we have in school. Just for an example, we have a date in Term 1 and we did de-escalation, so classroom de-escalation and behaviour management. Term 2, we're doing zones of regulation, which is a therapeutic regulation tool. We have colourful semantics coming up also at the end of this term. And then in Term 4, we're going to look at using widget. So our IAs can start to build those visual timetables, etc., which I will go on to discuss a little bit later as well.
And can I just ask, how do you prioritise which ones you're going to deliver and when in terms of the CPD for them?
We look at the students' needs. Ultimately, you've got your tier system. Your Tier 2 and Tier 3 are the areas that those students will need probably a lot more intervention and support. So if we can get all IAs together, we might actually separate it a little bit, and we have looked at doing that, where the Tier 3 IAs might need more specific focus on maybe social emotional support, or it could be sensory regulation and integration. So then we differentiate that way, looking on the tier scale, but also looking at the individual assistants. We do try and marry up the skill set of the IA to the students' needs right at the very start as well. So if we know a student is high in social emotional need, then we'll try and select an IA that has the higher skill set. And then we do try to share skills as well between the IAs, get them to do a bit of peer assessment and, a little bit of training and share that effective collaboration and strong working ethic between them. One thing I would say is that collaboration is key. So ensuring that the classroom teachers can communicate effectively with the IAs, but it's also reciprocated. So the IAs feel empowered, feel like they can communicate with the class teacher and let them know that if they're taking a student out because the student is dysregulated, then they can say, I think now is a good time just to take a 5-minute break if that student is not able to do that. We want the IAs to be part of the classroom environment, obviously not the learning, but actually be there maybe for safety or medical reasons. They could look at using timetables and identifying a key time where the student may need to go and take medication or may need to go out and have a rest break. And the IAs can lead on that and collaborate with the teacher as well. The challenges that we have come across is that quite often different timings, you've got changeover of classroom teachers, changeover of classes. Here we've got a large school, 3,200 students at the moment, and it's about getting the teachers familiar with the students, but also the individual assistants as well, and trying to build the relationships with such a breadth of different teachers and subjects. That's what we found quite challenging. Just got a note in the corner there, which is sources of CPD. I think it's important that you offer CPD to the individual assistants. We have a WhatsApp group with all of our IAs on, and whenever I see a free training session coming up, I share it with the group. I know Hannah shares them from ATA with me. Jeanette sent lots through as well on our Aldar Heads of Inclusion group. So whenever I see any training opportunity, I share it with as many people as I can. And then I ask them to let me know once they've completed it, because then that goes into my CPD tracker as well.
Excellent, thank you. Did you want me to move to the next slide?
Mm-hmm.
It's great that you also keep a track of all of the training that they do and presumably the certificates and things that they receive from that too.
I think it's important to have that, especially when we're looking at moving them through and showing where they've started and where they've got to right at the end of the academic year, but also for inspection purposes as well. Okay, sharing best practices. We will all have a plethora of best practice that you'll be using on a day-to-day basis. And actually, a lot of it comes without us realizing. And actually, we throw ourselves into all these different ideas, and the ones that really work, we just let fly and they go and they're really successful. But it's about reflecting on your practices and looking at which ones are really successful and potentially the ones that we need to reconvene on. We might need to put it to one side, look for a fresh idea or something different. If an IA is using sensory integration, for example, and the student is not quite following it, then how can we get the inclusion team to go and support with that? How can we use external therapy? Can we use online IA? There's lots of different ways that we can get our best practice up and running and shared between our peers. Just wanted to note on here that we use now and next boards, core boards for vocabulary. We use visual timetables. We use therapy rotas as well. So we have our therapy rooms. We use reward charts. We use our sensory integration. Our IAs receive some CPD on this. There's always a limitation to what we can offer in terms of time, because they do need to be with the students quite often, and it's hard to pull them away from that. But if the IAs can be upskilled in using a now and next board, using a core board for vocabulary, then these are the things that can be integrated within the classroom that the teacher doesn't need to have ownership of necessarily because they've got the full class, but the IA might be able to use these skills. These are not academic focused. These are using for potential speech and language needs, or a student with autism who might not be able to communicate their wants and needs as strongly as some of their peers in that classroom. That individual assistant can lead on that, and that will allow them to, integrate within the classroom.
Yeah, and I know that Jeanette may talk about in-school services, but do your IAs perhaps support students when they go to any of their therapies, yes, and then they can obviously repeat some of the practices that they see?
Yeah, we have a number of our IAs that attend therapy sessions twice a week, and they will pick up on the strategies that are used by the therapist. And I think that shared good practice between the clinical staff and then the in-school support staff as well. Then they can start to integrate and sharing with the teachers, sharing that with the inclusion team. And then that can be then put into DLP targets and can be linked to any other documentation that we have as well, pen portraits, anything like that. Is there any questions regarding kind of best practices? Just at the bottom there, you can see encouraging buy-in. That can be tricky when you've got a large team, a large school such as ourselves, the number of teachers that we have. It's about trying to get every teacher to understand the greater good and the benefits that collaboration and shared good practice will bring. I know students of determination can sometimes be challenging in the classroom, and we know that, but their needs need to be put first as well, and the teachers need to be involved in that and ensuring that that student can be the best they can be with the support and strategies that we're offering them.
Definitely, yeah. No questions yet, but they might be saving themselves for the end. So
no problem.
We may have that next. I don't know. Thank you for the training ideas that you've shared and some of the ways that you're sharing best practice. I think that we'll obviously move on to touching on some of the best practice that I've also popped down just to add to the list that you've given us already. And you'll see this really nice quote here from Diane Richler, who discusses or, talks about how it isn't just about getting students to fit into a system, but it's about transforming the system to make sure that everybody feels a sense of belonging. And it can also obviously create a benefit for everybody when a school is diverse and equitable from the very outset. So you touched on some of the best practices in terms of being able to share a platform, being able to share ideas with the teachers. Perhaps there might be opportunities to observe each other, whether that's IAs, inclusion teachers, or teachers themselves, being able to watch and see. It might be that there's a student who really engages in a specialist subject, but not so much in a general class teacher or homeroom teacher lesson. And so it may be that they go and see perhaps some of the behavioural strategies that teacher's using, and that's also really important. I think using each other as our best source of CPD is always really important, and it may be that you can informally mentor each other. Some schools use instructional coaches, and getting an opportunity to collaboratively plan where possible is really important too, and making sure that everybody understands the data that the school is using, whether that's GL, MAP, past data, attendance data. All of that can create and help form a picture of a student and their needs. So making sure that can be interpreted in the best way to be able to support a child is really important. Okay, so back to you, Jason, in terms of when you're selecting interventions and then evaluating their impact, what sort of criteria do you use and how do you go about measuring and tracking those?
So the selection process depends on the students, but ultimately we've got a guide where we look at communication, interactions. We use cognition and learning. That can be English and maths is how we kind of set it out. We have sensory or physical needs, disabilities. We have social emotional well-being, and we have independence and self-help. That's kind of our key areas that we look to identify a student's needs within those. From there, we have then branch out to our numerous different interventions that we offer. We have zones of regulation, which I touched on, which we've actually ran across our primary early years and year 1 and 2 phase now. And we're starting to embed that into the classrooms more regularly, because I feel it shouldn't just be a standalone inclusion practice. I think the more you can integrate it into every classroom, the students are going to get to understand their emotions more, how they can regulate themselves a little bit better, and that should have a real impact on the behaviour, but also the input that the students are giving. I think it's important to look at the needs of your students, your tier 1, 2 and 3, and then base your interventions off the back of that. We have a number of students who have speech and language difficulties. So it's looking at how can we work with the clinics and what they're using, and can we embed that into our practices as well. I think using those resources. Also, we use frameworks. So the autism framework, and we look at how we can use rubrics as well and implement them to identify students' needs and then track that progress that they're showing against potential targets. Ultimately, we come down to setting SMART goals for our DLPs. And the important thing I would say here is ensuring that the students' targets are achievable, especially when you look at this academic year. Term 1 was longish. We've got term 2, which is short, term 3, which is short as well. And it's important that we ensuring that our SMART targets are going to be achievable, because no matter what the students' needs are and the goals are, it's important that we're tracking and we're using our DLPs, our IEPs, whatever you want to call them, using them as a working document and tracking those short, small wins that we're getting along the way. And if something's not working, then can we revert back, reflect on why it's not working? Can we implement something different? I try and get the inclusion teachers to at least review it every 2 or 3 weeks, if they've got the capacity to do it, at least just to have, because the teacher will have the overall viewpoint. They've helped to write those targets. They understand the students. They're working day in, day out with those students. It's important that the inclusion teachers and our HLTAs also have an understanding of the students' goals, but the teacher should be embedding some more focus for the IEP target, the DLP target, should I say. And then tracking the data. So when we're tracking our data, we've adopted a system of using kind of 4-point color tiered. We use different colors which matches different percentages. So we have engaging, which is yellow, which is like 0 to 25% engagement. We have orange, which is emerging, which is 26 to 50% engagement. We have blue, which is securing. So that's the 51 to 75%. And then we have the green, which is mastered, which is 76 to 100%. And as we're tracking those, it shows like the color coding is much easier just to track rather than using percentages all the time. This is just our internal data, and it allows us just to see if they're on blue or on green. You can see that ultimately they're probably going to achieve either a securing or a master's tier. And then
how many targets are you giving a child to work on over a set amount of time, would you say?
We would normally say 3, 2, 3, 4, depending on the student's needs, but definitely 3 as normally a minimum. If we've got a student who's got a tier 3 and gets therapy or might need lots of additional support, we might put in some other targets that are focused on that as well. So it just depends student to student, but normally 3 targets is where we would want to be, because we feel that's achievable for what we can input there. When I'm looking at, sorry, I've got some data here. So when we're looking at the Education Endowment Foundation, they found that evidence-based interventions are improving reading, the literacy skills and levels for ALN students have gone up by probably about 4 months within a 12-week time frame. So we've looked at that and we've said, okay, we know out the region we're working in, we have students who have EAL needs. We have students with language barriers as well. And we look to try and implement some evidence-based skills from the EEF to try and upskill our staff, but also use it as a framework to support the target setting and then the data for impact on the back of that as well. Okay, do you want to move on to the next one?
Yes,
if there's
yes.
No questions.
Yeah, I was just going to ask a question. We haven't had any from the group yet, but in terms of the reading strategies that you are using with some of your students that you're finding are working, what are some of them, the interventions that you have in place?
So we have on a morning, we have a phonics breakfast club, which we've actually had a really good uptake with. We implemented it at the start of this term, and it went from about 3 or 4 to we're at about 15 now. So we've had to put more staff in to support. And that is just for that's open. That's an open invite for our EAL and our POD students as well. And we can see it slowly starting to increase. And also we use NESI as an educational system as well. I think it's great using technology to support that. It's bespoke. It's a bespoke learning pathway that is created once you've done that baseline assessment. So I would say use AI and what that offers to kind of push.
It's adaptive to the child's needs and where they're going.
Yeah.
Excellent. Okay.
And it creates it for you, so you don't necessarily need to follow a framework because it sets that flight path out depending on the student's needs.
Excellent. Thank you. So you recently were inspected and you were sort of judged as outstanding against, IEP targets or DLP targets. Tell us your strategy, tell us your secrets. You've spoken about the tracking system that you use to help students meet or exceed, and you've spoken a little bit about the data, but anything else that you use to help teachers help students?
Yeah. I think it's important right at the start, having everyone on board, knowing exactly the data that we're looking for, the data that we present. I'm a little bit selfish in the way that inclusion data is going to be my standalone data that I'm presenting. I know we have our in-class data, we have our assessment data that the classroom teacher is kind of collating and identifying and showing. But I think it's important that as an inclusion department, we're also showing the value that we add. What value can we bring to this student? And it's important about celebrating that. So having the meeting at the start of the year, we have PTC meetings as well. So parent-teacher conferences where we'll have our IEP meetings or DLP meetings with parents, but then the inclusion teachers will also attend the parent-teacher communications and conferences as well. So we're part of that learning journey, and we're all on board with where we want that student to go. What is their targets and what do we want from them, short-term and long-term targets. Once everyone's on board and we know, then we can start to look at what's embedded within the classroom, and we want the teacher to be leading on that quality first teaching, supporting those IEP targets. It may not be the fully supporting the IEP, the DLP target. It might be that a small snippet is being covered there, but then in our interventions, where our inclusion teachers, our HLTAs, are then doing the real focused work on achieving those securing to mastered grades. When you're presenting to inspectors, I think we've got our spreadsheet, and I think it's important to be able to track that actually, within the first term, it was a longer term. We started at the yellow and we've ended up halfway through the term, so mid-term break or half-term break, we're at maybe securing, and then by the end of the term we're at green. So you can use that color coding to track the progress. If you're at blue at half term and then you've got another 8 weeks and it remains at blue, you might get halfway through that second part of the term and go, actually, we're not really seeing that full progress here. What can we do to implement? And I think documenting that as well and presenting that to the inspectors shows that you are reflecting on your outstanding practice and you're saying, okay, this hasn't worked. What can we change? And then presenting it that way. On the back of this as well, I would definitely say that we also have our able, gifted and talented students. And I think it's about building case studies for those twice exceptional students, you know, those ones who are included in the inclusion department, but also maybe really high achievers. And showing the inspectors the work that we're doing. How do we stretch and challenge those students? Do we use advanced learner plans? Do we use invite-only ECAs, for example, to really stretch and show that we're supporting that student who's part of inclusion, but also to really show outstanding progress in their learning? And it could be social, emotional areas as well.
Yeah, exactly. Thank you. So just to sort of recap on the things that you said and obviously revisit them. When you're setting your targets, you make sure, you know, everyone's involved. We make sure that we're incorporating those targets into daily lesson plans from the teacher in terms of quality first teaching, IAs where necessary, pushing and pulling out support with your inclusion staff, frequently monitoring them. You said sort of every 2 weeks where they have the capacity to do so, and then collaborating with all of the stakeholders, whether that's the class teacher, the specialist teacher, the Arabic teachers, etc. Trying to make sure we have the evidence base by the different interventions, and they may have frameworks and tracking systems, and then making sure that we celebrate all the wins, no matter how small, I think are the sort of key things that you mentioned. So thank you. And you've mentioned some data yourself. I have some here from UNESCO, who have spoken about the impact that inclusion can have not only on students with ALN, but also neurotypical students, and saying that, you know, it can improve academic proficiency of all students, more so in an inclusive setting as opposed to a segregated session, by 22% difference, which I think sort of tells us the importance of inclusive environments for all students, and that's really key and really important. So thank you so much, Jason, for the things that you've sort of touched on and that you've shared from your own practice. And we're going to be moving on now to our second speaker, Jeanette. Thank you so much for joining us, from Cranley, Abu Dhabi. She previously worked for ADEC and helped write the new inclusion policy. And when researching this webinar, I found this quotation: inclusion is not just a policy, but a practice. So I really like that one. And I think it sort of shows that we need to be actively every day implementing actions, behaviours, decisions that ensure that inclusion is part of the policy, but also there is a cultural shift that is being supported by consistent focus, reflection, as you said, Jason, and then a sort of group effort towards inclusive practices. So thank you, and you have the floor.
Thanks very much, Hannah. It's a pleasure to be here joining you and Jason today. I know my face has been somewhat familiar around Abu Dhabi because of my work with ADEC, but I know that many of you also don't know me and don't know my background. So just to give you a bit of an intro, I've been a qualified SEN code for 15 years now, teaching for 25. And I kind of fell into special needs by accident, but it's become my passion, so much so that I've done a lot of further study and a lot of work with people who are learning the SENCO role and similar studies as well themselves. So it's something that I'm really passionate about. So since April last year, I've been assistant principal for inclusion at Cranley, Abu Dhabi. We're a British curriculum school with a slightly smaller cohort than Jason's. We have only 2,200 students. We're also spread across 2 campuses. So we have pre-prep, which is up to year 2, and year 3 to year 13 on the prep and senior campus, which brings its own logistical challenges, as I'm sure you can imagine. The next slide, please, Hannah. So looking at the social impact of inclusive education, as we said, it's really important that students are part of that community. So it's not just a case of, yes, we do have to kind of label them in some way, but we think about that. That's something that's an internal process. You know, it isn't something that students necessarily need to know about, and most parents, colleagues don't need to know about it as well. There's also a natural and morally requirement for confidentiality around that, but nonetheless, recognizing that some other children are different, some people are different, is really important. We have such a diverse community in terms of nationalities and experiences and backgrounds of our school community. So inclusion for me is a wider part of that, as well as that focus on additional learning needs. I'm going to go through with you some key points from the new ADEC inclusion policy with a little bit of insight as well from what was happening on the inside as we were putting it together. So you can see on the slide here a summary of the recent changes, highlighting just some of the key points. And the policy that precedes the current version was Policy 48 in the ADEC Private Schools Policy and Guidance Manual. That contained over 80 policies, which have now been revised and in some cases combined, as well as some new additions to the current suite of policies, taking into account some changes, for example, in digital technology. And the term additional learning needs is now used in preference to students of determination or special educational needs in our Abu Dhabi context. And as someone who was working on the policy at the time, I can assure you that we had many, many discussions in the team before we reached that terminology. And I'm sure some of you were still thinking, really? Why did they pick that? Maybe it's not what you would have chosen, but it was the best fit that we arrived at. And as Dr. Amina Khalil, an inclusion policy expert, said, policy changes are not just administrative adjustments. They're opportunities to redefine what inclusion means in practice. We very much wanted the ADEC inclusion policy to do exactly that. So this change of terminology is a key point because it changed the scope of the policy and it changed the requirements for schools. So previously, in some instances, provision was limited to students who met the criteria for students of determination, which meant they had to have a diagnosed disability. Instead, now schools must go beyond that. So the scope of the policy is children with additional learning needs, and that's with or without a diagnosis. So it incorporates students of determination, but goes beyond that. And one of the reasons for that change was that it avoids disadvantage for those children whose parents were unwilling or unable to proceed with a diagnostic assessment, and ensures their access to the support that they need at school. A further changes around admissions requirements. So the new policy extends beyond the mild to moderate needs that was the admission statement in the older version. And now parents have a right to apply to their preferred school, and in the majority of cases, the school must accept them. We recognise, though, that each school has its limitations. Even a school with, say, a specialist provision, such as a unit for children with autism, will apply criteria around age groups or the extent of support needs, and they might not be willing to accept, for example, in that school, students with a severe visual impairment or intellectual disability. I think it's important to be clear on to do what you can do well and not try to be an expert on all types of needs, and accept the limitations of your context. As Jason discussed earlier, the term individual assistance has also come into use for the first time, which replaced shadow teachers. They weren't mentioned at all in Policy 48 or any other ADEC policies. So at last, schools have a clearer understanding of when they can and cannot ask parents to provide an assistant and what the limitations of that role are. And I think it's also given parents more confidence that the school are committed to meeting their child's needs and not passing them on to somebody who may be relatively unqualified compared to the teaching staff. And finally, the standard inclusive provision was defined, and as part of that, a tiered model of support. So previously, there was no standardized way to record a child's support needs. And now we use tier 1, which is universal, tier 2, targeted, and tier 3, intensive and individualized, to reflect that children need different levels of support and that those change over time. The latest ADEC inclusion policy was first released in October 2023. The latest version was released in September 2024. I'm going to talk about some of the challenges that we faced at Cranley in regards to implementation. One of those is making sure that you have the most recent policy. And the ADEC policy has implications for the school's own inclusion policy. So given the timescale, by now schools should have updated their own policy to take the ADEC requirements into account, ensuring that they've covered all of the required elements. And when constructing your own inclusion policy, whether you're in Abu Dhabi or in another emirate, it's important to have an awareness of the audience. It's not just for the school, but for parents, students, governors, and school owners. And on the next slide, we're going to have a look at the reality of implementing the policy at my school. I hope there isn't too much background noise, but where my office is, year 3 are just going home and they're all walking past my room, so I hope you can still hear me really clearly and not hear too much going on in the background.
We can hear you.
Thank goodness for that. So managing and implementing policy changes. So I just like this. If you know the work of Dr. Seuss, it doesn't always make sense. And from here to there, sorry, from there to here, from here to there, funny things are everywhere. So yeah, I've just sort of reflected that it is a bit of a bumpy road. You know, there are twists and turns and best laid plans and all those kind of phrases come to mind. It is not a straightforward journey, but as a starting point, you've got to ensure that you understand the policy. So whether that's attending the ADEC training about the policy, talking to other colleagues, reaching out to the Students of Determination Office or its equivalent in KHDA or in your emirate for support, you need to be really, really clear that you are getting it right before you can be a part of that process. The first thing that I did, I think, when I got here was that obviously I had the advantage of having a very clear understanding of the policy, was completing an audit. So like, where are we now? Because that enabled me to draw up an action plan with a clear timescale. We're guided by that timescale for compliance. We know that we are already subject to compliance checks, but certainly we definitely have to have everything in place by September. But it also gave us an opportunity to go, what do we need to prioritize? What are the key tasks? Where do we need to start? And how does implementing the inclusion policy align with other projects? So although the inclusion policy had a bit of a head start and came out in October 23, by January of last year, the rest of the policies were released to schools and then public from September of last year. So there are lots of overlaps between the policies. So again, it's thinking about what else are we changing that feeds into this and what are the implications for this? And again, as an inclusion leader, you can feel like, okay, I've got this policy, this is my job, I have to do this. It really isn't. You can't do it single-handedly. So it's really important that you're involving others on your leadership team, on your inclusion team. And as we said before, inclusion is everybody's responsibility. So it's really important that everybody's on board with it. They need to understand what it is you're trying to achieve and the part that they play in that, which brings me on to the next point about providing training. So I've trained our inclusion team on the ADEC policy, our whole school staff on the inclusion policy that we've put together. It's really important that everybody understands what we're doing and why. And as you're working through that action plan, check in on yourself. How is it going? What can you tick off already? What's outstanding? What support, what resources do you need to try and move that on? Keep celebrating your success, because that's important to give yourself and your team and your colleagues credit for the things that they are achieving. In terms of, is it really that simple? Let me tell you about some of the bumps in the road that we've experienced.
I was going to ask you, any lessons learned or things that you can share?
I think for us, the biggest change in our context has been switching over to the tiered model of support. So we have almost 300 children on the register. We run at about 13% children with additional learning needs. So that was a lot of children to think about. And having trained the team on what it was the tiers meant, what does that look like? What might a tier 1 child look like? What might a tier 2 profile look like? So creating case studies about this could be a tier 1, this could be a tier 2 of fictional children. And then we had to talk in detail through those almost 300 children around what tier are we allocating this child to? Do we know everything we need to know about them to make this decision? Or do we need to have maybe some further assessment so we're really clear about their needs? And also reflecting on, they don't stay there. You know, just because I've put somebody on tier 2 in August doesn't mean they're tier 2 now. It's a really, really fluid system, and there isn't a week that goes by that we don't move somebody from one tier to another, either because perhaps somebody's sort of finished their intervention, it's opened up a slot, we can put somebody else on. If that intervention is finished and they're not receiving any support from the team anymore, we're going to move that child back to tier 1. There's still, I think, a lot of misconceptions in the around what tier 3 means. Does tier 3 automatically mean student has an individual assistant, they must be tier 3? Now, most of our students who are at tier 3 don't have an individual assistant, or conversely, that we have lots of students with an individual assistant who are not tier 3, because it depends what type of support they're getting and why. And as we've said earlier, the majority of the teaching is coming from the inclusion team and the school staff. It's not coming, any of it, from that individual assistant. So that doesn't necessarily correlate. We also had to look at systems that we use to record information at school. So although we've adopted a specialist platform for monitoring all of our learning plan data, creating pupil passports, communicating with parents about students with additional learning needs, behind that as well, we have a whole school use of a system called ISAMS. And so students with additional learning needs are flagged on there. So we had to change that so that it matched the tiers, and then be really clear that we understood the implications of that, so that if you were tracking data year on year, you know, we're not really now looking at the same group of people that we were. So that was something that we implemented at the start of this academic year. I don't think it would have been easy to do something like that mid-year.
We did have a question actually originally posed for Jason, but it sort of does link into the point that you're mentioning now. So one question was, what is it that you're using to be able to help teachers access or review a history of a student's IEPs? So with ISAMS, once you mentioned students moving from tier to tier or even off the SEN register, is there sort of an archive of information that you can access of historical targets or students where they previously were on and now they're off?
We are still running 2 systems. We managed to complicate things as much as we possibly could at the start of the year by switching from Google to Teams and Microsoft. So from having everything in Google Drive to everything in sort of SharePoint and OneDrives and things over that side. You can see my vagueness still, even now some of it's a bit of a mystery. So there was a wholesale movement of data, which mostly went smoothly. And we thought we'd complicate things even further by having this new system that we're using at the same time. So for us now, everything for this year, plus we uploaded their most recent learning plan from last academic year, and any historic assessments that they had done, any medical reports, all of that is on our new platform, which is I'm not going to mention the name, but it's a commercially available software system that we've bought, which I know a couple of other schools in Abu Dhabi use. It's widely used in the UK. So that's been really, really useful in terms of having everything in one place. The downside of that, of course, is we've still got the old stuff. So anything before their most recent learning plan is in our Cranley Common Drive. So if you really want to know what their term plan was like last year, that's where it is. But we know that over time, using this platform is going to help us build that complete picture. We've got parent meeting logs in there. We copy emails into there where we feel that email is something that we might need to come back to, so it's not hidden in somebody's inbox. And it's a great repository for all of that information about that child. So
it isn't necessarily an issue of not having enough information. You're almost in a position where you have too much information on each child.
It's got to be populated, and it's a system I spend time on, I think, almost every day. But the feedback from the staff has been that it's really, really useful.
Great. That's great. And Jason, is that the same for you in terms of historical IEPs or historical?
No, so what we've done, obviously, recently we've adopted the CPOMs and the ISAMs, where we're going to try and kind of collate all of our evidence, and we're starting to upload that now. But what we've done historically is use teams. So we've got a whole school team, inclusion team, that every staff member has access to. And it's got folders in there with DLPs, PEEPs, any risk assessments, any document that a teacher needs to be aware of that may be in their class or in their form tutor. And they can access that at any time, especially when they're doing their timetables. They're looking at lesson plans, seating plans, anything like that. They've got that data there to fall back on. We have our pen portraits. Pen portraits in there as well with cat data, etc. So it is there, and teachers can use it whenever they need to, just to look at it.
Thank you so much, Jeanette. Shall I let you move on to your next slide now?
So we're going to have a talk now about in-school specialist services. So if you're thinking, I have never heard those words in a sentence before, what does that mean? In Abu Dhabi, it's an ADEC database of licensed professionals such as occupational therapists, speech and language therapists, physio, psychotherapists. All of them already have ADEC approval and can come into school to work with students as soon as the appropriate agreements are in place between the school, the clinic that they work for, and the parents. And if you're in another emirate, you can still have therapists in school, and the content for this section is still relevant to you. It's just that you don't have the advantage of having that database that we use here, and will have to follow your own processes for clearance and approval. The research into partnerships between school staff and therapists shows that with effective relationships, the impact of therapy is enhanced. And at Cranley, we had, up to the end of the last academic year, in-house therapists who were directly employed in school. So the transition to using external therapists is a very recent one for us. Selecting the centre and the therapist was a crucial step. We wanted to get as close as we could to the partnership between staff, parents, the teachers, and the children that we previously enjoyed. And centres need like a decent sized caseload before they're willing to commit to sending therapists to school. So unless their clinic is really, really close to your school, they rarely want to send someone to work with only 1 or 2 children. You know, it isn't a good use for them because of the travelling time. We were lucky in a school our size that we could put together a reasonable caseload of children. I think the main challenges that we faced in getting it up and running was the cost and timetabling. For many children, even when we recognise their need, the therapists recognise their need, it isn't necessarily covered by health insurance. You know, it depends on your nationality, your employment, what sort of a grade of health insurance you've got, and how comprehensive that is. So where it isn't covered, there needs to be a willingness and a capacity for parents to pay for it. That isn't always possible. Another one is that with 2 campuses, we had to think about spaces used for therapy and having spaces in both places, what those spaces were currently used for, what resources were needed, how we could timetable those if resources and spaces had to be shared. So sometimes we have our speech therapist and our OT both come in on the same day. So we have to look at how is that going to work. There are always challenges in finding the best time in a crowded school day. You know, when are you going to take that child out of lessons, and which lessons, in order for them to have therapy? And then sometimes you remember also for some children, they're doing like piano lessons or drama lessons or something like that as well as, so there can be quite a lot of demands on their time. Feedback and the flow of information is crucial. So parents, staff, therapists, and the child all being aware as much as possible what those therapy goals are and what the strategies are that can support the child. And we capture those on our student passports, so the information is easily available to teachers. And as a school, we have a responsibility to ensure that our families are receiving a good quality service. And that doesn't mean that we're judging the therapy ourselves, because, you know, as teachers and school leaders, that's beyond our scope. I mean, things like holding meetings with the therapist, as well as the more informal conversations that go on day by day. And we also seek parent views on the therapy service and follow up on any concerns.
Excellent. And then touching on your parents and your community, I know that your next topic is going to be how you involve them in the community to sort of get them involved in initiatives and feeling part of a culture of inclusion.
It's something that can be quite challenging, because some of the events we've held for parents where they've had an inclusion focus, some parents aren't comfortable with that. You know, they don't want to show up to a meeting that's around, you know, supporting your child who's receiving speech and language therapy, or, you know, strategies to support your child with dyslexia, because as soon as they walk into that room, they are identifying themselves as a parent of a child with additional learning needs. And we don't see that there's any shame or any guilt in that, which is not to say that the parent isn't feeling any of those emotions. So sometimes it's, how can I bring those parents into a wider event that they are perhaps, you know, the number of parents who are uncomfortable attending might be fewer.
Yeah.
So sometimes it's what you call the session.
Definitely.
Even if the content is the same as it would have been, it's who do you invite and how wide do you make it. So some of them might be focused, and some of them more widely available to the family community. I think one of our real successes, certainly in terms of getting involved in things, like we have a close partnership with the Louvre at Abu Dhabi, because it is literally down the road from here. So there's been a lot of events going on there. But also, our children with additional learning needs do everything that everybody else does. They go on all of the trips, the residentials, the overnights, the internationals. They do everything. For us, it's our responsibility to make sure that they have those opportunities, that we are planning for what it is they're going to be involved in, that we are ready, that they are ready, that the teachers going on those trips are ready and prepared and well informed, that the staff who are going to be working with them when they're away from the school context are ready and prepared and supportive, because we don't want those trips not to be successful. You want those kids to come home and just think, I had an amazing time. And sometimes they might just need a little bit extra and a bit more of a close eye and a little bit more care and attention on your trip than some of those other children. And you can't always predict that. Some of the ones who need you the most are the ones you thought were going to be a lot more confident and a lot more resilient, who actually find being away from home really challenging. So for us, the ethos is just around making sure that everybody who wants to do anything that we're offering as a school can be a part of that. So it's our responsibility to make that possible. Coming back to, as you said earlier, it's about changing the systems. You know, the child doesn't have to adapt. We do.
Yeah, definitely. And I think your point about making sure that a child is included in every opportunity links us very nicely into our next quotation, in terms of making sure that within a community, everyone feels valued, respected, supported, but also that diversity is a strength. I've listed on the left-hand side some initiatives that schools could consider, but as you've said, think about the name and think about who's being invited, and just make all of it inclusive so that everybody can feel part of the community. And then, you know, as confidence grows, that will start to perhaps make staff, parents and students feel comfortable in being able to, you know, perhaps go to something like an Inclusion University Fair, which we hosted our first one last year at Yaz American School, where all of the Al Dar schools were invited to bring some of their inclusion department to come and meet universities. And that was a fantastic event. And I'm hoping that we will host it again this year. But there are also some other events and some ideas of things that can be done. So thank you so much, Jeanette, for your pearls of wisdom. And just as we start to finish up for today, I know that every year teachers, students, parents complete an ADEC survey. I don't know if it's similar in Dubai, but part of the questionnaire is, you know, what went well and what can we do to be better. And one of the question is on the basis of of inclusive practice. And as we can see, from 2015 to last year, there's been a steady increase. And we hope that with the new inclusion policy and with schools working to onboard, more IAs, more inclusion teachers, that these numbers will continue to grow and staff satisfaction will continue to increase. We haven't had any more relevant questions directed to either of you two, but there is still time for people to type questions into the Q&A box or into the chat box. But whilst you do that, or if you have no questions, I would ask you to scan the QR code, please, to be able to give us some feedback, perhaps on some other topics that you may want us to cover. But also we will generate a certificate for you for an hour professional development for having attended our session today. And if that QR code doesn't work for you, I have also, or will also be putting a link into the chat box so that can take you directly to the questionnaire to complete. So thank you to Jeanette and to Jason, but also thank you so much to everybody who has attended the webinar today. I hope that you were able to get some valuable insights, share some best practice from our two inclusion experts, and also give us some things of topics that you would like us to cover in future that may be useful for you. So thank you so much again for your time, and please join us in future.
Thank you very much.
Thanks for joining, and thanks, Hannah, for hosting and organising.
Thank you.
No problem. It was 1 hour on the nose, so we didn't keep anybody later than we should have done. That was perfect. Thank you, guys.
That's the teachers in us, we know how long a lesson is.
You can come again. Thank you so much for your time, and thank you in advance to those of you who give us our feedback. Take care and feel free to leave the call when you're ready.
Thanks, guys. Bye-bye for now.
Thank you.